We have a long-standing, decades-old relationship with India, with the Indian people, in particular around public health issues. Tonight, in fact, we're going to be sending a plane with supplies.
Then what's your own sense of that for people who have family and loved ones there?
People are worried. No question. People are worried.
Vice President Kamala Harris discussing assistance for India, which on Friday reported over 400,000 new cases, a global record. For more, let's bring in our friend Dr. Ashish Jha, Dean of the Brown University School of Public Health. Good morning, Dr. Jha. You heard that very frightening report from the New York Times reporter in India. Beyond the great personal tragedy, how does this affect the efforts worldwide to fight the pandemic?
Yeah, good morning, Martha. Thanks for having me on. It's a huge challenge. India, obviously 1.3 billion people. They're having just a horrible outbreak right now. We've got to help India get this under control for a variety of reasons. The humanitarian one, certainly there are geopolitical issues. But from a pure public health point of view, that large of an outbreak also is fertile ground for more variants. There are just many, many reasons why we've got to be very deeply engaged in helping India get this outbreak under control.
So the Biden administration is putting travel restrictions in place between the U.S. and India starting Tuesday. But it sounds like there really should be concern about the spread of this strain, possibly here, and whether it can evade existing vaccines.
Yeah, so the main variant that we're seeing spread in India, 617, B1617, I think will not be evading our vaccines yet. They don't evade our vaccines yet. Most of the data suggests that our vaccines will hold up. But of course, when you have major outbreaks like this, there are the opportunities for more variants. And ultimately, what we need to do is we need to get this under control. As I said, purely for humanitarian reasons. We just don't want tens of thousands of people dying every day. But second, that the variants will spread to other parts of the world, including the United States, will leave unvaccinated people in America vulnerable. So there's a lot of good reasons for us to be getting this under control.
And on vaccines, here at home, things are clearly improving with the number of vaccines now administered, but the pace of vaccinations is sliding. We've seen Michigan's governor announce a plan to tie reopenings to vaccination rates. West Virginia's governor's offering $100 savings bonds to young people who get vaccinated. What more needs to be done to encourage everyone to get vaccinated?
Yeah, now it's the ground game. All the people who really, really wanted a vaccine have gotten it. We're at about 55% of all adults. We need to get into the 70s and 80s in terms of proportion of adults, because obviously kids are not going to be vaccinated for a while. And therefore, I think it's about making it extremely easy, walk-in clinics, getting into doctors' offices, and then also working with trusted voices, religious leaders, civil society leaders, to advocate for getting people vaccinated. It's going to make an enormous difference if we can get some more chunk of that unvaccinated population with shots into their arms.
And the CDC issued new guidance this week on wearing masks outdoors. Critics say some of the guidelines aren't clear, don't really offer detailed explanations, and there's still no system to distinguish between who is vaccinated, who isn't. Are there any concerns with you about these guidelines being confusing?
Yeah, I thought the guidelines were a good next step. I mean, the big picture take home, and look, some of the details can be confusing, but the big picture take home was if you're fully vaccinated, outdoors is more or less safe unless you're in some very, very crowded space. The key issue now is what about indoors? And my sense is while infection numbers are still above 50,000 a day, almost half of adults are not yet vaccinated. CDC is going to be hesitant about pulling back on indoor mask mandates, and I think that's right. But as more people get vaccinated, we're going to see that pull back as well. This is a pretty dangerous time to be unvaccinated, but what CDC is signaling is if you're fully vaccinated, the freedoms are just becoming safer and safer for people.
And you have said earlier this week that you believe the worst is behind us. So do you think, as the CDC director said, that July could be a target date for reopening cities like New York City?
Yeah, absolutely. I saw what July 1st, Mayor de Blasio said, I think is very achievable. It's all dependent on vaccinations. But if we keep going, even at the slower pace, if we keep vaccinating Americans, I think by July 1st, you're going to see much of America feel close to normal. Look, it won't be 100%, but it's going to be pretty close to what life was like before the pandemic. And it's going to, as I said, it's going to depend on vaccinations, but I'm very optimistic about this summer.
Well, that's good news for all of us. Thanks so much for joining us, Dr. Jha.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.